Despite Evangelical Community Hospital's recent announcement that some of their facilities will be opening back up soon, there are still noticeable changes at the hospital and likely will be for some time to come.
This is totally unprecedented. I mean, there's no book for this. There's no directions. It's been very trying times.
Director of Surgical Services John Lewis misses the normalcy of his working relationship with his colleagues and realizes the new normal may not be the same as it was before the coronavirus pandemic.
We're a pretty tight knit group here, and so social distancing has been, that's part of that trying. It's we're used to seeing each other. We're in an environment. The operating room's an environment that's intimate, for lack of a better word. You're standing shoulder to shoulder with people for hours at a time. So you do get kind of used to that those connections, and so that part's been difficult.
It's definitely different in these times, but we're doing what we need to do to be able to keep the hospital safe for not only the employees, but also the patients and people that need to have care to come into.
Jamie Binkley is usually a registered nurse in the operating room, but is now also doing employee health screenings before they enter the building.
Okay, so we ask them if they have a fever, cough, shortness of breath, any new symptoms, if they have been exposed to anybody that has tested positive outside of here, and then we take their temperature and make sure it falls within the parameter that we need it to. So anybody that has a temperature over 100.4 we would call employee health, so that we can then get some further questions, and they decide then whether they should report to work or whether they should go home and be quarantined.
Mike Pope is far from his normal routine of being a plumbing foreman, but he's not letting that bother him.
What I'm doing is basically security work, directing patients, people that come in, make sure they go to the proper location, and whatever help they need, I try to help them as best I can. Even though it's not part of my regular job, it's kind of interesting meeting the people, and I enjoy helping people. So, and I mean, it's nice to see people go by and they see the flag and they beep their horn and they come and they thank you, and I thank them too. So it's been pretty interesting.
Mary Spencer is also out of her normal routine as a registered nurse in the endoscopy center by now helping to screen patients that are coming into the emergency room.
I find it interesting because I get to meet a lot of different people outside of our unit that I wouldn't normally meet, and I get to help patients in a different capacity. I'm in the ER screening patients. So if they have suspected symptoms, I would take their temperature, and I would call back to the charge nurse and let them know that we have a patient that could possibly have COVID, and then they would be escorted to our decontam area.
This area is the area that they're going to do an evaluation, determine their severity of their symptoms, if they're a patient under investigation or not, and then make that decision here as to which direction they're going.